The other day I was thinking about if sixth grade me would be proud of the person that I am today. My initial thought was that I wouldn't be proud of myself because I set these goals for myself at such a young age and I've yet to achieve them. But looking back, the person that I was in sixth grade, the person that was making those goals, setting those standards for myself, is completely different from the person that I am today, filming this podcast right now. My confidence was not as high. I was less knowledgeable as to who I was, and I wasn't as grateful for what I had had at that time because I was so focused on what I didn't have. I was so insecure about what I looked like and my grades, all of these materialistic things that just had nothing to do with my personality and really forming who I am today and forming a person that I would be proud of. So yes, I'd look forward, want to get into an Ivy League school, have $1 million by now, have all of these things achieved. But if it's all coming from a negative perspective, if it's all coming from a materialistic perspective, if it's all coming from a bad place, then that is an example of hubris rather than confidence. So when I look at hubris and when I look at confidence, I kind of think of it as a spectrum, with the lowest vibration being hubris and arrogance and the highest vibration being confidence. And there's a very thin, blurred line in between confidence and hubris at times, because sometimes if you appear overconfident, people can perceive you as arrogant, and sometimes when you don't appear overly arrogant or confident in certain situations, people will think that you're insecure. So it's really a spectrum of trying to decide where you are, who you are, and living your life with confidence rather than hubris. So this begs the question, what is the difference between confidence and hubris? So first, let's define hubris. Hubris, as seen by the dictionary, states that it is an act of excessive pride, overweening excessive pride in oneself. And that kind of relates to superiority complexes. Oftentimes when I think of hubris, I think of the literature that I had read in 10th grade, where there was an ongoing motif with a bunch of characters in the stories. All of these characters were inherently superior. They were stronger physically or mentally, or they had some sort of attribute that made them seem or just be inherently superior. And ultimately, their downfall became their hubris. Because they had these superiority complexes, what they believed made them the strongest and best person in the world ended up being their biggest flaw, hubris. So superiority complexes, as defined by the dictionary again, are a defense mechanism where individuals mask deep-seated feelings of inadequacy, insecurity, or low self-esteem by acting arrogant, boastful, or condescending. In other words, they're basically just projecting their insecurities out into the world by fulfilling this mask of appearing to be overconfident and arrogant and super full of themselves. And you can think back to it. I know if you're listening to this, you're thinking of somebody who you find inherently hubristic and who's always bragging about themselves and who's always showing off. And when I think about hubris and superiority complexes, I think of we're going to run it back. Okay. So superiority complexes can be inherently dangerous because oftentimes when you're only focusing on yourself and what you want to do and just your goals and what you want to achieve, communication with other people goes completely out the door. And that's not to say that goes completely out the door. So only thinking about oneself thereby limits communication, and something that I really do think of when I think of hubris and when I think of superiority complexes is, as I mentioned, 10th grade English class, we read Shakespeare's Othello, and I don't mean for this to be an English lecture, but so when I think about Othello is more in Venice, Italy, and he was inherently superior due to his strength and his ability to fight in wars, and that kind of led to his demise in terms of making him very full of himself. He had a superiority complex because he was so strong. And as I mentioned earlier, superiority complexes are often products of insecurity. So Othello was insecure that he didn't fit necessarily. He was insecure because he didn't necessarily fit into Venetian standards. He wasn't fully integrated into society as his own person because he was kind of just seen as this war victor and more rather than a person with sort of individual traits. So he really honed into his skill when it came to warfare and when it came to being a general and just being strong. And so that inherent superiority complex prompted him to be blinded. Now, it wouldn't be accurate to say that arrogance always leads to ignorance, but in Othello's case, he was so full of himself, so arrogant, so self-centered that he couldn't discern true or false when it came to interpreting external opinions by others. So he was ultimately sort of just blinded. Once you reach a certain level of arrogance and self-obsession on that spectrum that I was talking about, you neglect to think critically and you get so obsessed with wanting to appear confident and perfect, all in the search of validation. Because as I mentioned earlier with superiority complexes, they're based off of insecurity. And when you're insecure about something, you tend to seek external validation because you can't find that validation within yourself. And when you're only thinking about how you can, and when that validation factor is put into the hands of others, that's when you lose all of your power and you become easily manipulated and just malleable to other people's requests because you have no discrete standards for yourself. You might think of yourself so highly and you might only think about yourself and how others perceive you. And that just leads to being completely lost into who you are. And it's very easy to forget who you are when you're so obsessed with that validation factor. So despite having such superiority, going back to Othello's insecurities and reliance on other people's validations in hopes to be seen and just validated in society essentially led to his demise because he was able to be manipulated by other people. And if you're so easily swayed by other people's opinions, as I mentioned, you really do lose yourself. And hubris, I think, is really at the root being unsure of yourself. And so that sort of brings us into confidence. Confidence, as I said, is in the opposite spectrum of the hubris confidence sort of vibrational spectrum. Confidence is defined as a state of mind characterized by firm trust, reliance, or feeling of certainty in oneself, one's abilities, or the reliability of a person or thing. So when looking at internal confidence, when you look at yourself, confidence is defined as a state of mind characterized by firm trust, reliance, or feeling of certainty in oneself, one's abilities, or the reliability of a person or a thing. So looking back at my sixth grade experience, when I was reflecting on if sixth grade me would be proud of myself, it really brought me to this conclusion that back then I had so little self-confidence that I had developed a hubristic mindset of thinking that the only way that I can be validated is to be validated by others, because I couldn't grant myself the validation that I deserved and that I needed to truly succeed. And when you have that level of confidence, you also set standards for yourself. And when you have those standards, that's when you can discern what you want to do, how you want to do it, and just not take any BS from anybody else. Once you have your own confidence, external validation is the least of your worries. And when external validation is the least of your worries, then you can focus on what makes you feel fulfilled and validating your own. It's very cliche to talk about not caring about other people's opinions, but I think that in this specific social, political, economical, societal but I think in this day and age, with social media being so prevalent everywhere and comparison reigning supreme in every aspect of life, sometimes, as much as we say it, it is so hard to validate yourself, especially when you're looking at other people. I know that for me, college and, oh, no, we're not going to talk about college right now. I know for me, comparison has always been a huge problem, especially academically and just in this climate of this like scholarly climate, because I go to a school that has a sort of higher academic standard, I think, than some others. And so when looking around and seeing all these people with perfect grades, a long set of extracurriculars, and just their entire future laid out for them, I get a little bit jealous and I compare myself, because being in an academic climate that's so rigorous, that holds such a high standard, can oftentimes lead to a lot of comparison. Because if you think about it, it's kind of like turning on a lamp in a bright room. You don't even know that the lamp is turned on. Everything is already so saturated. And so when you look at yourself, you being the lamp, you feel as though you just can't make a difference, that you have nothing to offer because it's already such a bright room. But if you focus on the light that's in yourself and the lamp that you are, then you can. So when looking at hubris and self-confidence, I think the question sort of comes up of, what is that blurred line? When does self-confidence turn into hubris? When does hubris turn into self-confidence? Is there an overlapping there? And I think that the two are similar in the fact that they're based off of perception. But the difference lies at who is perceiving what. So when it comes to hubris, your focus is on how others perceive you. When you're looking at confidence, the focus is on how you perceive yourself. And you can determine which one is more productive than the other, I assume, by just listening to that statement. Confidence can lead to more self-fulfillment, less reliance on external factors, because you don't require as much validation. And so your mind is a little bit more clear as to what you want to accomplish, the standards that you want to set, and just everything that's a little bit more in line. And hubris, you're sort of focused on things that you can't control. And obviously you're going to feel a little bit unfulfilled because you're not getting exactly what you want, because it's all in the hands of other people. And I'm not saying to not trust other people. I'm just saying that you cannot ensure that you're going to get the amount of validation that you think you deserve from other people. You need to look within yourself. And I sound a little bit hypocritical because I do find myself in situations where I feel like I'm definitely not enough, and where my hubris gets the best of me, and I am so focused on the external factors, how other people are going to perceive me. But I kind of have to sit back and think, nobody cares about you as much as you care about yourself. And turning that care about yourself into self-care is so much more important than turning that into self-image. Self-image, self-care, being obsessed with either. Wait, where am I? So, at the end of the day, the line of reasoning is to live your life with confidence rather than hubris. Confidence will open up so many doors that you can make for yourself. Hubris will only close doors because the door might not be on your side. Hubris is reliance. Confidence is. So I'll think back once more to my reflection of if sixth grade me would be proud of the person that I am today. And I think that although our standards are very different, because sixth grade me, I would deem a little bit more hubristic than I am now, I would say that 6th grade me would be proud of the person that I am today because I'm much more confident in what I want to do, my passion, sort of where I want to go with my life, and I'm not as focused on the materialism of it all. Yes, some of my goals are still similar to when I was in 6th grade, but my approach to them is a lot less hubristic. I know I've said that word so many times. So in conversation with somebody that you might find hubristic, or if you catch yourself in times where you might be thinking about yourself way too much, just think back to this episode. Think about, so the key takeaways of this episode, I would say, is number 1, to think of the hubris and self-confidence spectrum throughout your day. When you're really overthinking something, or when you're having a conversation with somebody and you just feel like something's off, think of that spectrum, where you are on that spectrum. Are you leaning towards hubristic? Are you leaning towards self-confidence? How can you portray that self-confidence? Obviously, don't overthink it. Don't get anxious about it. But just have that in the back of your mind to keep yourself in check. I know that in the beginning of my self-development journey, when I was in probably middle school or early high school years, I would think about, I would overthink every scenario that I was going through, every conversation that I had with people. And I just realized that if I'm confident in myself, if in that conversation I'm saying exactly what I think I need to say to be fulfilled from my perspective of that conversation, rather than just relying on, or rather than just wanting to feed into whatever the other person is saying and just comply with all of their words, then I would consider that a success. If I was confident in what I was saying and I really just got my point across and I am fulfilled with how I handled that situation, how I handled that conversation, rather than just complying to whatever the other person is saying, then I would consider that conversation a success. I would consider that setting myself to the standard of being able to converse, even if that means not fully agreeing with the other party. And so I think it's important when you're thinking of conversations to not overthink, to not be incredibly obsessed with pleasing the other person in the conversation, but of course, being respectful. Number 2 takeaway would be to remember that communication is overtaken by a superiority complex. Superiority complexes can be some of the most damaging things to not only your relationship with yourself, but also, of course, relationships with other people. And so make sure that you prioritize communication in all of your relationships, especially your relationship to yourself. I know it sounds a little bit silly, but journaling and just really thinking and communication is just the number 1 priority overall. Number 3, finally, is to live your life with confidence and set standards for yourself rather than relying on other people's standards to be fulfilled. Look within to be fulfilled so that you can let your lamp shine in whatever environment you're in. You don't have to be the brightest in the room. You just have to be secure in the lights that you're sharing to yourself, because that light is going to shine brighter and brighter the more confident that you get. All right, on to the next half of this episode where I'm interviewing Dr. Lia Martin. On to you, future Sari. Everybody, we are back for our Sorry Not Sorry episode, and for today's interview segment, I'm here with clinical psychologist Lia Martin. Would you like to introduce yourself?
Sure. Thank you for having me. It's exciting to be here. I also love the name of the podcast. How clever that is. My name is Lia Martin. I'm a clinical psychologist with a background in child trauma and child development. I'm also a mom of 2. An 8-year-old and an 11-year-old, and I currently work at a nonprofit where I no longer do direct care, so I no longer see patients, but I lead up research, quality improvement, and a bunch of training initiatives within the agency. What else would you like to know?
I actually did see something about the nonprofit. What is it called?
So it's called the Justice Resource Institute, which doesn't necessarily imply that it does behavioral mental health services. Mm-hmm. It does. It has a large branch, and we have offices throughout Massachusetts, Connecticut, and Rhode Island, we do the continuum of care. So we have in-home therapy, outpatient therapy, therapeutic mentoring. We also have group homes, residential day schools, intensive residential treatment facilities, and even one juvenile justice facility. But there's also other branches of the nonprofit. They do legal work, advocacy work, and physical health, so HIV prevention and clean needle exchange and things like that as well. So they do a lot of different things, but the sort of uniting element is a social justice sort of value that is the foundation of all the services that they provide. So
wonderful.
Yes.
And that very much does align with Sorry Not Sorry, the podcast.
Love
Every
that.
podcast we have a little bit of a psychology lesson before the interview, and part of that has to do with a lot of adolescents struggle with anxiety and depression. So in your field, do you think you've seen an increase in anxiety and depression, especially after the pandemic and with this kind of global state?
Yes, sadly, I have. It's ubiquitous. It's nationwide. I see it within our own agency. So I do lots of tracking of high-risk incidents within our agency, and we have wait lists at all of our programs. It's really difficult to get beds for kids who are more acute and need a higher level of care. We see increased number of psychiatric screenings for suicidality, increased rates of suicide attempt within our agency, and that's across all the levels of care, so everything from the community-based and outpatient care all the way up through the residential services. So kids are coming in with more diagnoses, more acute symptoms. It's unfortunate.
How would you distinguish between developmentally normal teen distress and something that warrants clinical intervention? Because you mentioned how you work with a lot of higher risk and
more acute kids.
Yes.
Yeah, that's a great question. And almost all mental health diagnoses are sort of extreme versions of sort of normative processes and behaviors that we see. And so sometimes knowing when you've sort of crossed into that threshold of problematic can be tricky. And obviously with adolescents, there's a little bit of angst, right? Like that's a sort of
Definitely.
a normal part of growing up, and you've got hormones that are in flux. So you can feel moody, you can feel irritable. I think when you know things have crossed the line into something that might need treatment is when you see a real impact on your functioning. So you aren't enjoying things that used to be fulfilling to you anymore. You're spending less time with friends. You're disengaging from, the activities you used to participate in. Your grades are dropping. So when you see this impact on your functioning, and that impact is maintained over a few weeks even, I would say that's the point at which you say, okay, we're probably not just in the normal throes of adolescent angst, and we've crossed over into something that should get some attention from a professional probably.
Mm-hmm. And do you find that, how does adolescent depression present differently from adult depression, and why do you think that matters for treatment, especially in the long run?
With kids and adolescents, the mood doesn't often look as sort of sad and tearful. It absolutely can, but irritability is sort of a hallmark trait of depression in adolescence. And again, that can be tricky, right? Because irritability and crankiness and mood swings and all of that stuff can be a fun part of adolescence. But that is probably the hallmark differentiator. All the other elements are pretty similar. So you may see like sleeping more or sleeping less. Again, keeping in mind that adolescents have that shift in sleep cycle where they like to sleep later in the day. This would be more like sleepiness throughout the day, going to bed much earlier, or sleeping much less. And that's the tricky thing with depression, is that you can have more or less. You can have increased appetite or less appetite, right? So these are tricky things to sort through. Anhedonia, which is the decreased interest and decreased pleasure from things that you used to enjoy. And that's not like, oh, I used to really love playing soccer and now I'm over it. It's more like boy, I don't derive joy from any of the things that I used to derive joy from. They don't fulfill me. I'm not motivated to go. That is pretty common as well. Social withdrawal, like, no, I don't want to be with peers. I don't want to be around people. Indecisiveness, and just a lack of hope. I think is also a hallmark feature of depression, just feeling like, boy, nothing's ever going to feel different or better. I can't change anything in my circumstances.
It's called anhedonia?
Anhedonia is the
Wow.
fancy psycho jargon for a loss of interest and pleasure in activities.
Oh, interesting. I've never heard that term before, but
Yeah,
it's a
I
very
can throw
pretty
around
word.
lots of psycho jargon for you. It's good stuff.
Lovely. You specialize in trauma. You mentioned that you're a clinical psychologist that specializes in trauma. How has your understanding of what counts as trauma evolved over your career?
Ooh, that's a great question. So I think my understanding of trauma has evolved with the field's understanding of trauma. I think we initially thought of trauma as sort of these big life events, like car accidents, surviving like a hurricane or something like that. And over time, we've come to understand that there can be things called little t trauma, and that's really the subjective experience of something is really distressing. So something you and I might look at and say, that's not a traumatic event, like the death of your pet. If somebody really experiences a lot of distress from that, that can actually be considered a traumatic event. So really, what defines trauma is subjective. There are people who go through car accidents and they're not at all impacted in a traumatic sense, right? So distress is really a core element. It does not always have to be experienced distress, and that's what's tricky about it, right? Sometimes our central nervous system can give a stress response without us really connecting with the feeling of distress. So that's where things become tricky, right? Some people say, no, I didn't find that distressing, and yet their body is responding with a stress response. So trauma can be a tricky thing to tease apart. I think we also have come to understand the idea of developmental trauma a little differently, and that is sort of chronic, stressful experiences that often happen within interpersonal relationships as children are growing up. So things like neglect, physical abuse, sexual abuse. Sometimes a single incident can be enough, but the chronic nature can be really problematic in terms of undermining your sense of safety in the world, your sense of trust in relationships, and your relationship with yourself. So that's the type of trauma that I actually focus on in my own work and in the clients that I work with within our agency, or used to work with within our agency. And that's primarily the types of services that we provide within our agency is for developmental trauma.
And for people who may not have access to a formal diagnosis but have endured such developmental events that could be traumatic, how would you sort of remedy that if possible?
Treating developmental trauma is really complex because of the way it undermines not only your early bioregulatory systems, so much of how you learn to regulate your body and your emotions happens within the context of an early caregiving relationship, right? Like if a kid can't calm themselves down, typically it's a caregiver who's soothing them, take deep breaths, right? Like helping them label their feelings. When a kid doesn't get like normative developmental experiences like that, in fact, when the person who's supposed to help them with that is sometimes threatening their safety, and undermining their sense of safety in the world, it can be really detrimental to those biological processes and also their cognitive processes, the way they understand the world, the way they understand relationships. So the interventions are very complex for developmental trauma. What can someone do if they can't get access to care? I would say there are a lot of self-help books out there. Probably the best one that I would recommend for someone who's like adolescent and older would be a book on DBT skills, dialectical behavioral skills, because it teaches foundational skills for affect regulation, for sort of turning off that fight or flight response, right? So a lot of times when you've had trauma, you are on red alert all the time, looking out for danger cues, because that's survival. That's how you've gotten through life so far, right? And so your system is set up and geared for looking for those danger signs, danger within relationships, danger within the world, right? And so you're ready to mount a reactive fight or flight response all the time. And that can be really detrimental to your relationships and how you're functioning in the world. So DBT skills, dialectical behavior skills, they teach you how to sort of turn the emotion mind off and think with a more logical mind, how to develop communication skills to describe your needs and your feeling state. So it gives you some, and they're in really like clear and concise language, so they're easy to learn. So I would say that would be my recommendation. But I would say access to care has really improved because of telehealth services.
Yes.
And so they're really, while you may not be able to get yourself in the door to see a therapist right away, I would say, seek maybe telehealth services, seek services in a non-traditional way, support groups, things like that, because there is increased access because of technology, and that's great. So definitely get your name even on wait lists to get in the door, because for trauma, you definitely need a good, informed therapy with a clinician who knows exactly what they're doing.
Yes. Foundation is important.
Yes.
I know that especially during the times of adolescence, catastrophizing is a big part and setback, and a lot of the reason as to why a lot of people feel held back to do things. And catastrophizing, I know, can relate to so many things like trauma. So in your background with dealing with trauma, how have you dealt with that symptom of catastrophizing?
Good question. That is CBT language, so I can tell you have some exposure to that. Catastrophizing, that idea that you make the outcome worse and more extreme in your mind than the likelihood of that outcome happening to be. That, I mean, you can use CBT skills where you can be very logic driven around like, okay, let's lay out all the evidence that shows us that could happen or is likely to happen, and let's lay out all the evidence against that. With trauma, again, because it's such a subjective experience and because it's a lot about how things feel, not necessarily are. You don't want to, you want to be very, very careful about, what's the word I'm looking for? Undermining someone's feelings, especially because if someone's had developmental trauma, that is a core experience that they've had. Their feelings haven't been valued. Their experience hasn't been validated, right? And so I think you go with the core feeling. Like, that feels really, really scary. I can see how that feels really scary, and it feels like the outcome is definitely going to be X, Y, Z. But let's think about maybe times when we've been in a similar situation and it hasn't been X, Y, Z. There's been a different type of outcome. So I think some of it is about not being so extreme and black and white in your thinking. You can lay out the pieces of evidence that support, that idea coming true versus refute that outcome coming true. But validation is really, really important when it comes to trauma. Really appreciating somebody's experience and not undermining it, that core sense of self and one's experiences.
So how do you train for self-validation? Because I know that external validation is also something that is a huge part of adolescence that we all crave. But really finding it from within seems to be a bit of a struggle, but is also very important.
Daily affirmations. No,
Waking up and journaling.
I think that is a journey that everybody is on, right? I think redefining what success is really important, right? I think society has ideas about what makes a person successful or what makes a person of value. And so I think it's about defining that for yourself, figuring out where you feel, when you feel authentically you, when you feel self-actualized, when you feel confident, when you feel good, when you feel creative, when you feel connected to people. And that's really experiential, right? And it comes from giving yourself a wide range of experiences, and allowing yourself to try new things and to be creative and to not be afraid of failure, but to learn from failure, right? To take lessons from failure and say like, okay, that didn't work out. Here's what I learned. Here's what I can do differently. But to understand like perfection is not the goal. Like failure is just a normal part of being a human, and building resilience from that. So I don't, there's not like a perfect recipe for learning how to be confident and self-actualized and validate yourself. But I think that's a good starting point.
Is defining the issue?
Well, I think it's about reframing.
Yes.
You know what I mean? Reframing and setting your own sort of course and sort of learning about like what do I value and what brings meaning to me, not letting sort of other people around you define that,
So what are your thoughts on short form content? Do you think social media can be a tool for mental health, or do you think it's a curse from your background?
I have thought a lot about this recently. I think there are some ways it can be helpful. I do think the negatives outweigh the positives, honestly. I think there's a way that short form media, social media reaches a wide swath of people. And so I think people are talking more about mental health and about treatment and about symptoms. And there's a way that reduces stigma. And there's a way that increases access. And it gets the conversation out there. I think also there's a lot of misinformation out there. Like sometimes it pops up in my own feed because of what I do, and it's like signs of ADHD and adolescent girls, and I watch it and I'm like, this is so wrong. And it's so not helpful to spread this type of disinformation. And so that concerns me a lot. And then I think there's just the broader impact of social media and short form content on really sensitive developing brains and adolescents. And that concerns me. I think we know that it affects kids' attention spans in a negative way, and their divided attention. And I think there's a lot of problematic messaging that happens, not just about mental health, but like in general on social media and short form content. There's an emphasis on, what's the thing I need now? What's the way I need to look now, right? There's the way that we make everything a highlight reel, right? And so it makes life and experiences like unattainable to kids, right? Like everything's glowy and pretty and perfect and curated. And then if your life isn't like that, that can feel really demoralizing.
Yes.
There's the bullying that happens, there's exclusion that happens, right? Like you see your friends made like a reel of them doing something that you weren't invited to, and all of a sudden you feel terrible about yourself and you feel excluded and you feel like why wasn't I a part of that? So I think there's unfortunately, I think the negatives outweigh the positives.
I agree. I think that social media is very disillusioning.
Yeah. Problematic in a lot of ways.
It's true. I mean, it does help to spread. I guess the ulterior side of it is communication and I guess accessibility too, because
Absolutely.
people would be more accessible to care. But once again, as you said, there's a lot of misinformation. So I think that can also threaten a lot.
I think until we teach, social media literacy, I think until we teach kids, like, how do you vet, is this good content? Is this true content? Like, come to it with a critical eye. Until kids really have those skills, they can't really sort through like the large swath of stuff that's out there and know, is this misinformation or is this accurate? And that's really problematic.
It's true. So what first interested you about psychology and trauma specifically?
What first interested me about psychology? I think I have always been intrigued by people. And I don't know why, but I remember distinctly this experience, maybe elementary school, being on the school bus and having a kid very rudely be like, "What are you staring at? Do you have a staring problem?" And I was kind of like, "Yeah, I do. I am just observing everybody on the bus, and I probably would start staring at them and watching their interactions unfold and being curious about like, well, why did this kid do that? And why did that kid respond that way? And just being so intrigued by like human behavior. It's so fascinating and so complex. So I think from a very young age, I was an observer of human behavior and a thinker and very curious about just what makes people tick. And I think I have a helper-fixer orientation as well. And when I was younger, I would kind of like insert myself into, people's problems in a way that probably wasn't great. And then I realized, like I could get some training and figure out how to do this the right way. I also had some friends in high school go through some pretty intense mental health experiences. I had several friends with eating disorders. I had a friend who was suicidal and confided in me about that. And so I realized, like, maybe I'm not terrible at talking with people about the stuff they're going through. Maybe I could make a career out of this. And then I took an intro to psych class in high school as an optional course, and I loved it. So that sort of set the trajectory really early. How I got to trauma, I actually really thought for a while that I was going to study eating disorders. Again, I had two friends in high school who had pretty profound eating disorders, and I was pretty interested in that. And then in my junior year of college, I needed to get a job. And so I got a job as a counselor in an after-school program for kids who were in high-risk homes. And so as part of them participating in this free after-school program, they participated in research as well. And I was both like an after-school program counselor and this research assistant combined. And that was my job as a junior in college. And most of the kids in my group, they were little. They were like 5 and 6 year olds. And some of them had experienced abuse and trauma. And some were incredibly resilient and well-functioning and really like wonderful to engage and be with. And some were really struggling. I actually had a 5-year-old pick up a chair and throw it across the room. He was so dysregulated about something I think we told him he couldn't do at the time. And I just became so curious as to why are some of these kids doing well and some of these kids really struggling when they've had the same types of early experiences with trauma and risk. And I wanted to understand that better. So that was sort of the beginning. And then I realized as I got more training, as I got into grad school, that trauma is ubiquitous, unfortunately. So many people experience trauma, and so many different mental health diagnoses result from trauma. We call that multifinality, if you want some psycho jargon. The idea that the same sort of precipitating factor can lead to a whole different range of mental health outcomes. It's called multifinality. So I was seeing people with OCD and social phobia and depression and generalized anxiety disorder and eating disorders and PTSD, and they had all had trauma, and it was manifesting in different ways. And that was really intriguing to me as well. So that was sort of my journey to child trauma. It was sort of like, okay, let's get to the root of all this. Oh yeah, they all have this in common, child trauma.
Do you think that it's genetic, the way that people handle their trauma and their response to it? Because you said that there was a relationship between diagnosis and trauma.
There is certainly genetic risk in most mental health conditions. The degree to which genetics play a role is not very well understood, and it's probably different for some types of disorders, for sure. And that's not the full story, right? So everything is nature and nurture when it comes to mental health. There's nothing that's purely genetic, and there's nothing that's purely the result of your environment and your experiences. It is an interaction between the two. And that interaction isn't particularly well understood at this point in time of sort of like, so who is going to end up with PTSD versus who's going to end up with OCD versus who's going to end up with nothing at all and be resilient.
That is so interesting, because I sometimes wonder that as well, like why certain people come out differently even though we have similar backgrounds, especially
siblings.
Yes.
You see it all the time in siblings.
Exactly. because we were nurtured the same, right? So you have to expect it to be nature, but it could also be how you perceive the world differently. Which, could that be your own personal thing, not from nature or nurture?
I had a colleague in graduate school who was really interested in resilience and understanding what promotes resilience. And it's a very multifaceted thing. So some of it is your cognitive perceptions, right? How you make sense of the world. Some of it is your abstract reasoning and your cognitive flexibility, your ability to make different meaning out of experience. Some of it is intelligence. Some of it is personality. So some people have a temperament that's sort of, I don't want to say like more easygoing or more likely to be unrattled, unfazed by things. Some of it is your early childhood experiences, your family structure, your community structure. It's very complex. So understanding sort of all those elements and how they interface is a challenge of our field constantly.
I know there's so many unknowns that are still out there. It's very...
The research that I find really fascinating when it comes to understanding nature versus nurture are twin studies. So twin studies are really neat because you're taking two people who have the same genetic code and often similar early rearing experiences, but not the same, right? Like two siblings can have very different relationships with the same parent, right? Different relationships with their own siblings. Different relationships with the world. And so there is this way that you're kind of controlling for the impact of environment, but also that they have two totally different sets of experiences, basically from the get-go when they come out of the womb, even though they're living in the same home, right? So twin studies can be really, really interesting at shedding light on sort of how much of any particular mental health outcome is nature versus nurture.
You talk a lot about how family life and developmental trauma can come from early life. So you have a family of your own. How would you say having a family has changed you go about your work?
I will say this. When I had children, that was when I left direct care. To do trauma therapy, you have to have a thick skin because you're hearing all the time about really horrible things that humans perpetrate against other humans. And when you hear a lot of it can really alter your sense of like what the world is like, right? So when I had my own children, when I started a family, all of a sudden I was like, I really don't want to be reminded every day of the ways that my children can be harmed in the world. So I took a step back from direct care. And that's when I actually went into my current position, which is the research, the training, and the quality management. So I'm still doing work in the trauma field, but I'm not hearing constantly every day people's trauma stories. Yes. And I really did that to protect myself, honestly, my emotional well-being. We have a finite amount of emotional resources, and I wanted to be able to give those to my children. So that was the other reason I took a step back, is that I was giving a lot emotionally to my clinical work, and I felt drained when I would come home and like I couldn't give the same amount of emotional attention to my own children. So that was a sign to me to kind of switch gears as well. In general, being a psychologist and a parent is a really interesting experience. You have a lot of know-how from your training and your education, and it's also really easy to like pathologize normal things because your framework is to look for that. So you have to be careful sort of all the time that you're not pathologizing really normal experiences, and you're not like psychologizing your own family.
I know. I used to talk to my physical therapist about it, and he would always talk about how whenever he sees somebody, this is a irrelevant tangent, but off the record, my physical therapist would always talk about how he would judge how other people move.
Yeah.
And be like, yeah, he has a damaged rotator cuff. You can tell by the way.
You can't stop seeing the world through that framework.
That lens, yes, that's true.
Because that's how you've been so focused on seeing the world that way for your career. So yeah, it's important to be able to kind of step back and be like, okay, right now my kids need a parent, not a psychologist, right? But yeah, a lot of the way like I talk about feelings with my children, though, come from my training.
Yes.
So in some ways it is helpful because I have a lot of tools. And I'm like, okay, I can deal with this. I know what this is. I got this. You also feel a lot of pressure, though. I will say, being a child psychologist, you feel this sense of like, okay, nothing can go wrong with my kids because everyone expects me to know exactly what I'm doing all the time when it comes to children and child development and emotions and stuff. So if I'm messing up, then I get double judgment, like judgment for, not doing right as a parent, but also judgment for not doing right as a psychologist. And that could be a heavy burden at times.
You have any final thoughts that you'd like to add?
Oh boy, final thoughts. No, just I had a great time. Everything we talked about was really fun for me to discuss. I hope people learned a little bit. I hope people stay curious. I hope people do their self-validation.
Yes. Expressing gratitude.
Yeah, and just being open to new experiences for sure. And never like letting the curiosity die. Yeah.
Alrighty. Thank you so much for listening to this week's Sorry Not Sorry podcast episode. And thank you, Dr. Lia Martin, for joining me today. I hope you all learned something and stay curious. Bye.